We discuss Zach Lavine's season-ending foot injury and different types of foot problems in athletes. Welcome to another update on MD Talk Health and Fitness. Today we're turning our focus to the basketball court, specifically Zach Lavine of the Chicago Bulls. Lavine, the dynamic shooting guard, is facing a setback with right foot pain leading to surgery that sidelines him for the rest of the season. Foot injuries, particularly in NBA athletes, can range from minor to severe, all possibly requiring surgery. Common issues include stress fractures, plantar fasciitis, and tendon injuries. These conditions are not just limited to basketball, but are also prevalent in soccer players due to the constant running and footwork. Symptoms can vary from sharp pain, swelling, to difficulty in movement. Differentiating plantar fasciitis, stress fractures, and tendon injuries in athletes involves a combination of clinical examination, patient history, and sometimes imaging tests. Here's a brief overview of each condition and how they might be distinguished. Plantar fasciitis symptoms: sharp pain at the bottom of the heel, particularly severe with the first steps after waking up or after long periods of rest. Pain decreases after a few steps, but might return after prolonged activity. Clinical signs: tenderness on palpation of the plantar fascia's insertion on the heel. Diagnosis: primarily clinical based on symptoms and physical examination. Imaging is not typically necessary but can be used to rule out other conditions. Stress fracture symptoms: pain in the foot that worsens with weight-bearing activities and improves with rest. Localized swelling and tenderness. Clinical signs: a focal spot of severe tenderness on the bone when examined. Diagnosis often requires imaging to confirm, such as an MRI or bone scan, since early stress fractures might not be visible on standard X-rays. Tendon injuries, symptoms: pain and swelling in the affected area, weakness, and limited range of motion. Pain might be more diffuse compared to a stress fracture. Clinical signs: tenderness along the course of a tendon, pain with active use of the associated muscle tendon unit. Diagnosis can be clinical, but ultrasound or MRI may be used to assess the extent of injury. In athletes, it is not uncommon for these conditions to present similarly, making it challenging to diagnose based solely on symptoms. Clinicians will often use a combination of a thorough history, like the onset of pain, any inciting events, and the character of pain, physical examination, and selective imaging to arrive at a diagnosis. Moreover, response to treatment and functional tests during follow-up can also help differentiate these conditions. Overall treatment may involve rest, physical therapy, or in cases like Lavine's, surgical intervention. It's crucial to mention that we don't have specific details on Zach Lavine's medical situation and are not affiliated with his care. Our discussion is based on general information about foot injuries in athletes. Recovery and rehabilitation are key, and we wish Zach Lavine a smooth and speedy return to the court. For more health and fitness news, keep it right here on MD Talk Health and Fitness.